Hello everyone, in this lecture I am going to cover up different health committees framed at different times. First committee 1946 में बोर कमेटी इस्टेब्लिश हुई. जो मेन फोकस इस कमेटी का था, मेन रिकमेंडेशंस थी टू इस्टेब्लिश द प्राइमरी हेल्थ सेंटर्स इन द रूरल एरियाज. इट वाज द मेजर रिकमेंडेशन ऑफ द बोर कमेटी. इसके अलावा इंटीग्रेशन ऑफ प्रिवेंटिव, प्रोमोटिव एंड क्योरेटिव सर्विसेज इन दीज PSCs and the 3 months training of the doctors in PSM department. These three were the major recommendation of the Boer committee initiated in 1946. The motive of the 3 months training in the preventive and social medicine department to create the social physicians. एंड जो प्रिवेंटिव वर्क है बोर कमेटी में जो रिकमेंड किया गया, इंटीग्रेशन ऑफ द क्यूरेटिव एंड द प्रिवेंटिव सर्विसेज एंड द एम्फेसिस वाज ऑन द प्रिवेंटिव पार्ट. एंड द विलेज हेल्थ कमेटी इज ऑल्सो रिकमेंडेड बाय द बोहर कमेटी. 5 से 7 लोगों की लोकल विलेज हेल्थ पीपल की कमेटी बना दी जाए, जो एक्टिव पार्टिसिपेशन के थ्रू जो लोकल पब्लिक है उसका जो भी करंट हेल्थ प्रोग्राम रन किए जाए उनमें उनका participation हो. This was the aim. So preparation of the local village health committee including the 5 to 6, 7 members is also a step of the Boer health committee. So preventive, promotive, curative services along with the intersectorial coordination. हम सभी जानते हैं ये सारे ही कंपोनेंट जो प्राइमरी हेल्थ केयर के मेन कंपोनेंट्स हैं. So these were important point of the Boer committee. Next committee established was the Mudaliar committee, established in 1962, and the major recommendation of the Mudaliar committee was to strengthen the PSC primary health and district hospital, those initiated during the time of the Boer committee. जिनमें जो services Boer committee के द्वारा propose करी गई थी, preventive, promotive and integrative as well as intersectoral coordination, all should be strengthened, and there should be and this committee is also known as the health survey and the planning committee. 1962 के मुडालियर कमेटी के बाद 1963 में चड्डा कमेटी आई. चड्डा कमेटी का जो मेजर ब्रेक थ्रू था was the basic health workers and the family planning health assistants. जो basic health worker क्या कॉन्सेप्ट था कि 10,000 की पॉपुलेशन पे जो malaria 1962-1963 at the time when the malaria was the time when the malaria eradication program was in operation. So to take care of the all functions of the malaria eradication program, these basic health workers are responsible for per 10,000 population, and along with this malaria eradication program को help assist करने के अलावा they would be and they act as the multi-purpose workers to look at the statistical and family planning services as well. And the family planning health assistants were to supervise 3 to 4 such basic health worker. इन 3 से 4 basic health worker के ऊपर एक family planning health assistant होगा. So the concept of the basic health worker and the family planning health assistant, these two things were the recommendations of, were the creations of, we can say, of Chadda committees, and we can remember the date 1963 at the time of all these were committees like Mudaliar committees and the Chadda committees were at the time of the malaria eradication program. So we can remember this. फिर 1963 के बाद 1965 में मुखर्जी कमेटी आई, जिसने ये कहा कि फैमिली प्लानिंग के लिए देयर शुड बी अ सेपरेट स्टाफ बिकॉज इट्स नॉट पॉसिबल दोज बेसिक हेल्थ वर्कर्स शुड कैरी ऑन द मलेरिया एराडिकेशन प्रोग्राम एंड दोज ड्यूटीज along with the family health care services. So there should be a separate provision of the staff from the family planning programs. So this was the major recommendation of the Mukherjee committee. After that 1967 Jangalwala committee, the main point can be asked in the MCQs is the Jangalwala committee recommended कि private practice should not be there by the government doctor, elimination of the private practices by the government doctors, as well as the integration of the health services was the point of the Jangalwala committee as well. In 1973, Kartar Singh committee comes into the action and was initiated, and what was the major recommendation of this committee was separate work for the female and male health workers. So designation as the female and male health worker, and clear cut job responsibility of these workers has been defined in the करतार सिंह कमेटी. और जो ANM होती हैं उनका नाम रिप्लेस करके नाउ फीमेल हेल्थ वर्कर जाना जाए, और जो बेसिक मेल हेल्थ वर्कर्स थे या मलेरिया सर्विलांस वर्कर थे, वैक्सीनेटर थे, ऑल दोज ड्यूटीज़ वर असाइंड टू द मेल हेल्थ वर्कर्स. और जो लेडी हेल्थ विजिटर थी that should be designated as the female health supervisors, and clear cut designation of these duties of these workers were made in the Kartar committee. This was the major recommendation of this committee. Now few more questions about the committees can be asked in the multiple choice question or one liner question कि this committee is related to what. So रेनिका रॉय कमेटी इज़ लाइक 1960 में स्टार्ट हुई, और स्कूल हेल्थ कमेटी स्कूल हेल्थ सर्विसेज से रिलेटेड कमेटी है. मेहता कमेटी जो 1957 में फ्रेम करी गई थी, वो कम्युनिटी डेवलपमेंट प्रोग्राम 1952 के CDP को असेस करने के लिए, परफॉर्मेंस असेस करने के लिए. एंड सेम मेहता कमेटी फ्रेम्ड एट द 1983 में मेहता कमेटी के ही नाम से वो मेडिकल एजुकेशन रिव्यू बोर्ड कमेटी है. एंड कृष्णन कमेटी इज रिलेटेड टू, सो डेट का डिफरेंस है दोनों मेहता कमेटी में. एंड कृष्णन कमेटी 1982 में इट्स रिलेटेड टू द health services in the urban and areas and the cities, and Bajaj committee is related to the health manpower planning, reproduction and management. So this is all about the all committees, and the questions can be asked multiple choice or one liner question can be asked about these committees, and even the short note can be asked. Thank you.